I'm joined by Health Minister Greg Hunt, live from Canberra. Minister, thank you so much for your time. Good evening. Now, a week ago today, the Prime Minister did a big press conference and he showed us 4 graphs explaining why we need to flatten the curve. Last Sunday, we had 300 cases. Today, there are 1,286 confirmed cases of coronavirus. Are we failing to flatten the curve?
No, with respect. We have always said that this would be a global outbreak on a scale unprecedented in the last 100 years. And we all need to be aware that that means that we will see many cases, many cases. What we have done is to be able to delay the onset in Australia quite significantly and dramatically, to be able to slow what it would otherwise have been. It will continue to grow, and I think the only honest statement is to be able to say that. But as of today, the advice I had from the Chief Medical Officer is that less than 20 people out of that number have been in intensive care, including those that lost their lives. And so what we're seeing is a very interesting phenomenon where, because we are testing so broadly and widely, we are catching as many cases as possible, obviously. We are in the midst of what is a global pandemic, an epidemic in Australia, but by catching those cases, we're able to take care of people and have early diagnosis and early treatment.
Well, Minister, let's go back to the figures. And you're right, we have delayed the onset of this, but now the cases really are starting to spiral. Looking at the figures, Australia on March 17 had 455 cases. 2 days later, that jumped to 756. Italy, at that stage of the disease progression, had 470 cases on February 26. 2 days later, it had jumped to 889. The figures show we're on a very similar path to Italy, don't they?
Well, I think the point is that we had our first case in January. We were able to contain for over a month, but all along, we said that we are talking about a situation where Australia could potentially have hundreds of thousands, if not more, cases. And it is absolutely essential that we recognise that is the gravity of what we are facing. There are some who have believed that might mean that we were suddenly able to stop at 1,000 or 11 or 1,200 cases. That's not the case. This is a highly contagious disease which for the vast majority of people will be mild, but for those who are vulnerable, most especially the elderly, can have deep and grave consequences.
So if we keep going,
absolutely.
If we keep going as we're going at the moment, are we set to repeat the devastating situation that we are seeing in Italy?
Look, I won't compare us with other countries, because what we see when you look at any specific country, Korea and Singapore, is that the way that the population has responded has been extremely important, where they are following the advice, keeping the distance. They've actually been able to keep a lot of their economy going whilst also practicing the advice of hygiene, which, although it seems so simple, is so absolutely fundamentally indispensable, of self-isolation and maintaining that, of social distancing. Those 3 things: hygiene, social isolation for those that need to be placed in that private quarantine arrangement, and social distancing. Those are the 3 great things that each person can do to help protect Australia.
When you say overseas the population has done their bit, are you saying that Australians aren't doing enough, aren't fulfilling their responsibilities at the moment?
No, it's exactly the opposite. What we have seen is a remarkable response. Of the people that have gone into self-isolation, tens and tens of thousands, we've had virtually only a handful of cases where there have been reports of people breaching that. That is an extraordinary achievement so far. But this will now become more challenging and more difficult. What we really need to do is also be maintaining not just our personal responsibility, but showing the care for others, for the elderly, the isolated, to be providing that support to them as a government, but as each family supporting other families.
Minister, you mentioned a moment ago that you've always said that hundreds of thousands of Australians are likely to get coronavirus. Is it the case that the latest estimates are that 60 to 70% of our population will get it?
No, I won't put any estimate on like that. There are a range of different scenarios, and where we end up depends on how we collectively and individually respond. And I think that's the extremely important thing. The future is not determined. The growth, yes, absolutely. But where that ends up will depend on how we collectively and individually respond, which is why we have taken unprecedented steps in terms of the last 100 years with regards to gatherings, why we've done that in terms of the distancing and hygiene, and additional measures are now being taken by the National Cabinet.
Exactly, and I'll get to those in a minute. But look, we talk about everyone's responsibility. I want to go to this cruise ship debacle. The Ruby Princess docked in Sydney on Thursday, and its 2,700 passengers have since spread around the country COVID-19. The number has now risen to 18 who are infected, and this is just going to probably likely keep rising. Who let this happen? This is pure incompetence.
Well, I don't want to be critical of any of the states, because we all absolutely have to work together, and there has been recognition by those involved that there are lessons to be learned. We have been very clear that there are rules that have been in place, and I am pleased that those lessons have been learned. But what we see here is that the message is clear. All of us, no matter where we are, whether it's governments or individuals, have to take that responsibility.
But isn't it the federal government's responsibility as well? I mean, very clearly you're putting the blame or the pressure back on Brad Hazzard and the New South Wales government, but isn't Border Force the federal government's responsibility as well? And shouldn't they have ensured that everybody who stepped off that ship had a temperature check at the very least?
What you'll see is that the disembarkation is carried out at state level by the relevant health authorities. I'm not saying that in any critical way. I think that they are doing a fantastic job on the contact tracing. They are following people up around the country.
They wouldn't need to do the contact tracing if these infected passengers were allowed to disembark, though.
Well, let me be clear that as the Prime Minister has acknowledged and others at state level have acknowledged that there have been steps taken following that, and the last thing I want to be is critical here. I respect that people are working in very difficult circumstances.
Look, Minister, as of midnight on Friday, our borders closed to all non-Australian citizens. Given 80% of cases from coronavirus in Australia are from overseas, in hindsight, do you think the government should have taken this action to close our borders much earlier?
Well, I think what you've seen is that we had previously already imposed the 14-day universal quarantine period, and so that self-isolation means that everybody who was coming from overseas had to go into isolation, as well as being one of the first countries in the world right at the outset to put in place the China, then Iran, and then Korea, and then Italian decisions, all of which have been moving early. And at the time, and this is important to understand, many of those decisions were criticised as being too early or being too excessive. I remember the decision in terms of China was criticised by many as being excessive or alarmist. It wasn't. It was preemptive, and that's what we've tried to do all along.
But after being ahead of the rest of the world, and as you just said, you were ahead of the rest of the world in making some of those early travel bans, we were then among the last to completely close our borders. So why didn't we do this earlier? Why did we wait for the number of cases in Australia to explode before we shut our borders?
No, with respect, Australia is still one of those countries which, in terms of where the disease progression is, has taken those border measures, the universal quarantine for everybody coming into Australia at a stage which is much, much earlier in the disease progression, and then secondly, in relation to the total exclusion of non-Australians, again in the disease progression. So these are steps that are being taken. Remembering that it's very important to be able to bring...
80% of the cases came from overseas, can you understand why the question is being asked? You know, why didn't we just shut our borders earlier, and we could have prevented a lot of this outbreak?
I think it's important to know that in terms of the medical advice is not what you've just said. The medical advice has always been that Australia will not be immune from this. That this is a global epidemic that will travel around the world, that will have an impact on all countries. When last I saw it was over 180 countries. and that there is no immunity. But what we can do, when we say flatten the curve, what does it really mean? It means fewer people spread over where we're protecting the vulnerable, and they're the fundamental things that we are doing, in a way beyond anything that had ever been contemplated with regards to the speed and the strength of action. And all of those things, I think, are an important reassurance. I know there will be people with different views, but again, where the decisions have been made in the course of the disease progression, where it's been in Australia compared with others, these have been made at lightning speed to protect Australians. And this is going to be a very difficult few months, like nothing we've experienced, even compared with what many experienced domestically, not obviously on the front line during wartime, but in terms of domestic privations. And so the economic measures announced today, the health measures to protect the population, the testing regime, which is at the absolute global forefront, all of these things will help protect Australians, and ultimately we'll get through this.
Minister, are you disappointed that New South Wales and Victoria effectively ignored the federal government advice to announce that they would be closing schools this week and to shut down non-essential businesses?
My understanding is that the school holidays were generally coming at about the end of the week. I couldn't say exactly in each case, so this is a matter of a couple of days here or there. So I understand and accept that, and we're not in the business of criticising individual states. The National Cabinet under the Prime Minister set out the framework. They will outline their reasons for making the local decisions under that framework and how they expect those to operate.
We've heard in the past couple of days, though, the Prime Minister, Scott Morrison, repeatedly outline his case, and so you've done this as well, for why you think the schools should remain open. And you've said that when the schools do shut, they're likely to remain closed for the rest of the year. You've spoken about why it would be more dangerous to have children potentially out in Westfields and out on the streets, gathering elsewhere, being in contact with grandparents. And yet Victoria and New South Wales have ignored this and have come out, and New South Wales, Gladys Berejiklian has said tomorrow she's likely to have something to say on schools, and Victoria has already said their schools will close. So why have they ignored your advice, and have you lost control? Has the federal government lost control of managing this coronavirus crisis?
Well, again, as I say, that's a matter of days in terms of when the school holidays are. But more generally, the medical advice has not changed on that front. So what will be absolutely critical is that if schools are moving more to online learning, that they provide the capacity for health workers and essential service workers, those that are involved in critical activities, to have their children taught so as we can maintain those people at work. Maintaining the health workforce will be absolutely critical, and that's what the message is from the Prime Minister to the National Cabinet this evening.
Now, the advice from the World Health Organization that's been supported by people like Bill Gates is that we both need to test rigorously and go into lockdown to get control of the coronavirus. Now, parts of the country are now set to go into lockdown in the coming weeks, presumably. At least non-essential businesses are closing in Victoria and New South Wales from tomorrow. But we are failing, aren't we, when it comes to doing testing? There are not enough testing kits and equipment at the moment. At the moment, you can only get tested if you've come back from overseas or been in contact with a confirmed case. But isn't this now outdated, given that the community transmission is starting to be more and more widespread?
In all of the world, there are very few countries that have tested more than us.
But isn't our criteria outdated? But isn't our criteria outdated because there's community transmission?
I'll explain why there's a very different view from the medical authorities. Other countries have had a much higher rate of positive tests as a percentage of their total tests. We have had a less than 1% positive rate from our tests. What that means is we are testing more broadly and more widely than almost anybody. Our negative test rate is higher than Korea and the UK and the United States on a per capita basis. I think we're more than 40 times higher than the United States. We're at 127,000 tests.
Isn't this partly because, as you point out, our progression of this virus has been better than other countries? So when they were doing their tests, their virus had already progressed further, whereas ours is only now starting to take off and explode?
Well, I think what you find is that we are doing the testing. You can't say we're not testing and then say, OK, well, you have been testing. We have been testing is the simple answer. We've been testing on a rate and a scale that is right at the global forefront. We've been testing more broadly and widely than virtually any other country, as evidenced by the fact that it's a less than 1% positive rate. The Chief Medical Officer and the Deputy Chief Medical Officer have said it's not that it's a different disease here, but we are testing more broadly and more widely. But we're continuing to test more. We have just prior to air approved the first point of care test for Australia. The head of the TGA has done that. That is likely to be able to be rolled out over the coming weeks around the country. What does that mean? It means you can get a very rapid result without having revert to a laboratory. And so
are we talking a couple of hours or how rapid?
They're talking within a couple of hours. I'll let the TGA provide the specific advice.
Is this the fingerprint test?
Most importantly, with respect, I'll let the medical authorities provide the medical advice. I've been advised that we have a point of care test, which means that it can be done on site with a response on site within a short period of time.
And how many of these have you got?
Well, hang on, let me just finish. Thank you very much.
Of course.
What this means is that in terms of the pathology tests, we already have a very large number. We've had 3 shipments arrive in Australia in coming days, and now the TGA is working on identifying the quantity, the supply. And what we're doing is we're procuring on all fronts at all times, developing new tests, which we announced yesterday, approving new tests, which we've just announced as you and I have been speaking, and acquiring new testing equipment for existing tests with 3 large shipments that have arrived over the course of the last 5 days.
So will the testing criteria now be relaxed, seeing as that you have new tests coming in?
Well, I don't think that's a decision that should be taken by anybody other than the medical authorities. And the reason why is because, as I say, if we've been testing more broadly and more widely than virtually anybody else, as evidenced by the fact that we have the highest negative rate of all of the major countries for which I've seen data, that means that we are testing widely, but now we're able to continue to test, but then we have the capacity to continue to expand that testing regime. And so we're making sure that we're doing it commensurate with the need and the ability, and therefore finding those cases.
Minister, I really appreciate your time, and please make sure you stay safe so that you don't come down with this in Parliament this week, because obviously you're needed to continue leading us through this crisis. So
thank you. Do you mind if I say something here?
Of course.
You know, at some stage, people right across the country, we'll all know somebody who's either been diagnosed or is connected, and we all have to recognise that. And the vast majority of these people, the vast majority, will only experience mild symptoms. Nobody's to blame unless they did something catastrophically silly. And so it is a unique situation. So I appreciate very much those sentiments, but equally to the general public, we're going into unprecedented times, but we are going to work through it together. Many will be ill, but if they are ill, please do the things that really matter and help take care of them. Thank you.
Thank you so much, Minister. Really appreciate your time.